Anjali, you're a top dermatologist and a real specialist when it comes to acne. And what is the difference that you've seen AviClear making to your practice?
We've had AviClear now for coming up to about 14, 15 months.
Okay.
And since that time, I think the biggest change that it's made is one more additional option that acne patients have. Previously, the only real option that you had is if you had severe acne, for example, isotretinoin or Roaccutane would be immediately what you jumped to. There was never an in-between option. But now to be able to give somebody an option that is drug-free in the form of a laser that can potentially have similar effects to isotretinoin, can treat severe acne, is pretty incredible.
What makes a good candidate for AviClear treatment? Are some people more suitable than others?
Because the laser is actually FDA-cleared for mild, moderate and severe acne, technically you can use the treatment on anyone that has acne. So it doesn't matter what skin type they are, what age they are, it's a suitable treatment.
And are you finding that patients are more curious about non-medication options?
Absolutely. I mean, I think there's a certain degree of, firstly, a group of patients who have had long-standing chronic acne. They've had multiple courses of all sorts of medications, isotretinoin included, and they've relapsed. Really interesting to see the different groups of patients that we've seen that have thought, actually, we want to try this. We don't want to jump to hormones. We don't want to jump to tablets.
So what do you say to people who say, is a laser really going to treat acne?
There's no reason why laser treatments, if they are targeting the right thing in the skin, can't work for acne. And I think that's what makes AviClear quite different, because the specific wavelength of light that it uses, it targets oil glands in the skin, or sebaceous glands. And sebaceous glands are that unit that aren't working properly in acne-prone individuals. So yes, there may be other lasers that people have used in the past before AviClear came out, but the problem with those lasers is they are not specific for the sebaceous gland.
Came in and filmed a lovely patient of yours, Shaheen. And how did his treatment go for the rest of the time that he came to you?
It was amazing how inflammatory his acne was at the beginning, how red he was, how cystic it was. It was painful for him as well. And actually, even by the end of the second and the third session of AviClear, you could see his inflammatory burden had reduced significantly.
I feel a lot more confident now, and like friends and family, they always tell me that the skin's looking way better than before.
How you deal with the huge amount of misinformation about acne that's out there?
I think that drives me crazy, to be totally honest. It really does. Partly because it's actually delaying people getting the right treatment. So it's hugely problematic, and a big part of our consultation is actually trying to say, look, you're here now, ignore that generic advice, some of it which is wrong. This is tailored to you on what's right for you.